Welcome, and thank you for joining us today live or on the recording for episode 28, When the Leaks Disrupt the Love, Understanding Incontinence and Its Impact on Intimacy. I want to take a moment to sincerely thank you for listening. Your presence here means so much to me. You are the reason that this podcast exists, to share knowledge, foster connection, and support one another through life's most intimate and human journeys and experiences. I am truly grateful for each and every one of you who tunes in. So thank you so much for being here. We are on social media. We're out there on Facebook. We're on YouTube. We're on X. We're on LinkedIn and Kick too. If you're on X and you have a question, go to YouTube or LinkedIn, Facebook, and you should be able to, where they allow you to send those questions in. We need 100 followers. If you're a Facebook person, please follow us so that we can also do even more things on Facebook than we're already doing. So thank you if you're a Facebook person. Go to the website. You will discover the many, many wonderful episodes, the excellent guests that we've had on. You can watch any of those on the website. You can pull up the calendar, see what's coming up next. We have a lot of exciting things coming up, so you can look there as well. Listen to us. We're where you are. We're in your car. We're working out with you. We're doing whatever you do on Spotify, on Amazon Music, on iHeartRadio. We are there with you. And you can learn about sexual health while you work out or ride in your car. Want to remind you of a couple things. All are welcome. Whatever your sexual orientation, your gender identity, or your relationship style, I am so glad that you are here and you are so welcome in this space. So welcome. The goal of the podcast is simple: to empower and enlighten you with the evidence-based scientific information you need to improve your sexual health, to deepen your relationship, helping you to love and live more fully. On today's episode, I'm very excited. We're talking about something that affects millions of people, but is often unspoken: urinary incontinence, and how it can impact self-esteem, relationships, and intimacy. Whether it's fear of leakage during sex, feeling embarrassed about accidents, or simply knowing where to turn for help, incontinence can deeply affect one's sexual well-being. Joining us today is an internationally recognized expert. This friend and colleague, we have been friends. I was thinking about this for, I think, over 3 decades. And when I first entered the field of urology, I was learning from her, and she was an amazing mentor. I can't think of anyone better to talk about this topic. You'll hear about some of her accolades, but she is amazing. Dr. Diane Newman is a nationally and internationally recognized expert in urinary incontinence, in pelvic floor disorders, and bladder health. She has a doctorate of nursing practice. She's board certified as an adult nurse practitioner, and she's a fellow of the American Academy of Nursing. With decades of experience, she has led research. She has NIH research grants. She has started clinical innovation in all kinds of areas with catheters and things like that. She's done public education to improve lives of those dealing with bladder control issues. Dr. Newman has authored numerous peer-reviewed publications and books, including the Urinary Incontinence Source Book. She served as a consultant to the National Institute of Health, Centers for Medicare and Medicaid Services, and she is an industry leader in pelvic health. She's also the section editor for Grand Rounds in Urology, and we just did a couple of those episodes together. Her work has helped destigmatize incontinence and empower patients and patients and providers alike, to prioritize pelvic health as essential to quality of life, including sexual health and intimacy. She currently serves as co-director of the Penn Center for Continence and Pelvic Health at the University of Pennsylvania, where she continues to advocate for evidence-based, compassionate care. Please welcome my good friend and colleague, Dr. Diane Newman.
Thank you so much, Jeff, for such an introduction, and I really appreciate it. And you're right. I think we go back like 3 decades. But I really want to commend you because, when you started this, I was thinking, wow, what a great way to get out an area that people really don't talk about. I know where I practice in the area of pelvic floor dysfunction, a lot of practitioners don't ask about sex. Mm-hmm. And the issue is are you sexually active, but also do you have lower urinary tract symptoms during sexual activity? So thank you very much for bringing this topic to your audience because I think it's very, very important. As Jeff said, I've been, practicing in urology actually since 1986 when I started in kidney transplants. And I've been at the University of Pennsylvania for over 23 years doing both clinical practice and research. And I've seen men and women either who've come in with lower urinary tract symptoms that happens throughout their day, throughout the activity, but also who are recovering from procedures that we do in urology that may be causing problems during sexual intimacy. So I really appreciate you bringing this topic out and really discussing it openly, right?
Absolutely. I'm so excited. And so I know if you are one of those people who has trouble and you leak urine or with urgency frequency, I mean, all of us have experienced some sort of urinary episode in our life. That's for sure. You are not alone. And I am so excited to explore this topic tonight. So just sit back and relax and listen because Dr. Newman's going to give us an awesome presentation. And Diane, it's all yours.
Thank you so much. So what I'm going to talk about is when the leaks disrupt the love, understanding incontinence and its impact on intimacy. As Jeff said, I'm an adjunct professor of surgery at the Perelman School of Medicine at the University of Pennsylvania, Philadelphia. I'm also senior editorial director of Brand Rounds in Urology. And one of my goals is really to get education out there in the field of urology. But let's talk about intimacy and the problem of incontinence. And what I thought I'd first do is give you a little bit of background of incontinence. Urinary incontinence is any leakage of urine when you don't want to. So it's really involuntary urine loss. Some people call it accidents, leaky bladder, weak bladder, I gotta go problem. But there are certain types. The first type is stress urinary incontinence. I hate that term stress because when I tell my female patients, it sounds like your symptoms that you have stress incontinence, I've had several women say to me, I knew it was stress. My kids drive me nuts. It has nothing to do with mental stress. It has to do with stress or pressure on the pelvic area from above. When you laugh, cough, or sneeze or exercise, you have what we call weak outlet, so that urethra that keeps tight until you want to go and pee, it's weak and drops of urine will come out. So that's the first type. The second type is urgency incontinence, where stress incontinence may be episodic because it only occurs during maybe activity or a cough. Urgency incontinence occurs after urgency. And a lot of times people will say, when I gotta go, I gotta go. I rush to the bathroom because I can't make it there in time before I leak. So that's really bladder dysfunction. And with that, we see overactive bladder symptoms of urgency, frequency, and even nighttime voiding. So you can have a lot of different symptoms with urgency incontinence. Unlike stress incontinence, which is really small amounts, maybe drops, urgency incontinence can be your entire bladder volume leaks out. So it can be really quite disturbing. We see stress incontinence sometimes after pregnancy. The data shows 1 in 3 women develop stress incontinence. 6 months, they persist with it after having a baby. And that's important because really, that can be very negative, right? Embarrassing with any type of sexual activity. Urgency incontinence, we tend to see in the menopausal years in women and then with aging. Now, both stress and urge is called mixed incontinence. And we also see stress incontinence in men after prostate cancer treatments such as radiation or maybe surgery or even maybe from an enlarged prostate. And then with aging, we see mixed urinary incontinence. But what I want to get to is what happens during sexual activity or during intimacy. But I want to give you a little bit of background about the different types so that you understand maybe what may be happening. So sexual incontinence, there's a couple of different terms that we use. Coital incontinence is urine leakage during sexual intercourse. And this occurs usually during penetration or orgasm or throughout the entire sexual activity. Climacteria or climacteric incontinence is leakage at the time of orgasm. It can be drops to ounces. You see both coital and climacteric incontinence in both men and women. The third type is arousal incontinence. This is leakage during the time of physical stimulation, but also it could be even just psychological arousal, thinking about maybe something sexually, that you start to maybe lose some urine. So it could be one or the other or even both. So those are the different types of incontinence. And this is important because one of the things that I know that Jeff will agree with me on is the fact that as providers, we may not be asking individuals, even in urology, men and women, do they have urinary symptoms? Do they leak urine during sex? You know, I have to tell you, it's always been part of my history, and I do ask about what are your symptoms, whether they have stress or urgency incontinence. But I do ask, when does it occur? During the day, during the night? Are you sexually active? Does it occur during sex? And I have to tell you one story that has stuck with me for years, and this happened to me probably over 10 years ago. I had a woman in her late 30s. She'd had one child. And she had developed stress incontinence after having the baby. The baby was a very traumatic birth. She was thinking of getting pregnant again, and she was worried that her incontinence would worsen with a second pregnancy. So I was talking to her about her symptoms and, what kind of her goals were. And I said to her, well, do you, have any leakings during sex? And she said to me, well, I avoid sex because I do have leakage and I'm so embarrassed by it. And in my head, I'm thinking, wait a minute, what's wrong with this picture? You're trying to get pregnant, but you're avoiding sex because of incontinence. And, she wasn't really making that link. And I talked with her about that. And we tried to see what I could help her with, because what was her goal? She wanted to get pregnant again, but she didn't want to worsen that urinary symptom of incontinence. So, this I think is a very important slide, especially with women, is a lot of providers don't ask and a lot of patients don't tell. You really sometimes have to be asked several questions to really get to the root of maybe if someone has issues with incontinence during intimacy. Women, the data shows that 1 in 4 women, sexually active women with urinary symptoms, report urine leakage during sex. So they may have other urinary symptoms such as incontinence during the day, stress or urgency. They may have urgency, going to the bathroom frequently, and then they may also leak urine during sex. Coital urinary incontinence has occurred and has been reported by women. 24 to 66% of women with incontinence also have coital incontinence. So what that means really is that we need to be asking our patients. And if you are someone that does have problems, you need to seek treatment. You need to really talk to a provider, talk to someone, who maybe can help you with that. But 3/4 of women visiting a urology clinic for incontinence and other bladder issues report not being asked about it. And, as someone who, and I'm sure Jeff will feel this way too and express how he feels about this, but, we're in urology and we like to think all of us practicing in this specialty practice ask about this, but I have to tell you that's not the case. Jeff, of course, that's been a mainstay of his practice. It's part of my practice of pelvic floor dysfunction or pelvic floor health, I call it. But what I hear from women is that most women say nobody even asks about it, even when they see a specialist. Now, when we get to men, I think it's a little bit different. Men tend to report more. Women tend to deny or kind of hide their urinary problems. Men tend to be more open. It may be because we see men after maybe doing something to their prostate, but also they do have incontinence during sexual intimacy. Climacteric incontinence is reported to occur in 20 to 93% of patients after prostate cancer surgery. So after undergoing what we call a prostatectomy, men do report the fact that they do have urine leakage with a climax. I hear that all the time, with an orgasm. And a lot of them avoid sex because of the fact that they're worried about it. Or they'll start to tell me that when they start to get aroused, they leak urine. So that really is a downer, okay? And that really cuts, they'll tell me, well, there goes my erection if I leak any urine. So arousal leakage is reported by 49% of men. at some point during the recovery from prostate surgery. So, this can be a major problem with men. And, they've gone through maybe being treated for cancer, and they want to get back to as normal life as possible. And of course, sex is a really important part of life for both men and women. So this can be very, very discouraging and embarrassing to both men and women. Now, when you look at some of the research in this area, what happens with individuals who have incontinence during sexual intimacy, it really impairs the body image. They avoid it. I mean, you can imagine that, if you wet yourself or you wet the bed, say you're on a bed and having some sexual activity and it gets wet from urine, that can be a real turnoff. I've had several patients over my practice, women coming in their 70s and 80s, in their 60s, who are widowed, and they're starting to date again, or they have a new significant other. And they come to see me because they say, well, before my husband died, for years, we were not intimate, and it was because of incontinence. I want to be intimate with now a new partner, someone new that I've met, and I'm really worried about wetting myself. What can I do? So this is a concern of women of all ages, and men mostly, again, as they age and have prostate issues. It impacts emotional well-being. It's shameful. They're embarrassed. They have anxiety. They fear, like we're telling these women are fearing, what's going to happen if I want to be intimate with a new person? And it really causes relationship strain. You can imagine that I hear that women who are in good marriages, who have really good, great, strong partners and strong relationships, don't even mention that they have incontinence, or why tell their partner who they love, who they may have been with for years, that maybe why they're not doing anything sexually or they're not attractive. It's not them. It may be because they fear that incontinence and that leakage. And the thing is that can really strain a relationship. It does have an impact on sexual function. There's data to show that individuals who have incontinence during sexual intimacy, it reduces the sexual desire, which makes sense. And it causes complete abstinence. They have difficulty with arousal, especially if they're leaking urine while they're trying to be aroused. They have decreased sexual satisfaction. They may have painful sex, because this could be in older women who have decreased estrogen hormone in that whole area of the pelvis. It causes vaginal dryness. And then it also may have issues with poor lubrication. So there's all these impacts on sexual function. So, we really have to recognize that as clinicians in this area. Well, what can you do? And I get asked this quite a bit. Basically, seek treatment. There are some simple measures. If you want to urinate, or I say pee, before you are starting to have some kind of intimacy, you may want to double void. What that means is that you go and pee. Once you feel your bladder's empty, stand up, sit back down, and try to go some more, because always a little bit left in that bladder. So you want that bladder as empty as possible. You want to have open communication with your partner. You really need, if you have a good relationship, you really want to stay, I have a concern about this, so that you can work on it together. Men, they'll say to me, well, I'm worried about leaking urine in my wife's vagina or my partner's vagina. Use a condom, okay? Some men find that if they put a tension constriction ring applied to the base of the penis prior to foreplay, that might be beneficial, because what you're doing is you're compressing the tube that goes from the bladder to the outside, the urethra, which is on the base of the penis, and that kind of compresses it so the urine won't leak out. There's also surgery. In men, artificial urinary sphincter may be an option, or even a male sling to stop urinary incontinence. Women, try different positions, okay? I talked to you in the beginning about stress and urgency incontinence. With sexual intimacy, we're not sure which it is. It's probably a combination of both stress and urgency. So sometimes changing position, maybe with the woman on top, that might help. So there's no compression on the abdomen and the pelvic area. That's, there won't be pressure that pushes the urine out. So try a different position, because sometimes that really does help. There's also surgery. Try to maybe treat the incontinence. And what I should have put in there too, for someone who has urgency incontinence and overactive bladder, medications also can help that. And the other thing I talk to patients about is there can be a trigger for some leakage during intimacy. So see if you can figure out what that trigger might be. I don't know. It may be that you drank a lot before you were having intimacy. Maybe you want to cut down on that. It could be something like you had coffee, even alcohol. There are bladder irritants that may also trigger leakage during intimacy. So try to see if there's a correlation or what we call a trigger, something that may be causing you to have that problem during the intimate time of your life there. So I want to thank you, and I think Jeff and I are going to have a little discussion on that, but I want to thank you for listening. That I know was just very quickly, but it's just a discussion about trying to bring up this topic and really to try to seek treatment about it, because there is treatment, and really find a clinician that really you can talk with about this, because there are solutions.
Wow, Diane, thank you so much. Great information, definitely. I think there's a lot to unpack there and think about, and I know you too have found with your patients. This is something that's very distressing for our patients. People, they're very distressed about it. They feel stigmatized. They worry so much about it. Even sometimes they'll say, even if it's not leaking right during sex, they're like, but the odor, I think I smell. They're so concerned about all that, right?
Mm-hmm.
And what's interesting is too, some of them are the most fastidious, clean people that I've ever met. They're like, because I always smell the urine. And I'm like, look, I'm examining you and I'm not smelling the urine. You don't smell like urine, but they're so concerned about that with sex. It's just such a difficult thing for so many people that they struggle with.
Well, and you brought up something that actually I didn't bring up in what I just presented is odor. That's a really good point, Jeff. People think that, it's going to smell and, what's going to happen there. I actually either worried about the smell, and, most urine doesn't really smell. Actually, the smell of urine is really dependent on medications you take or their foods. Like if you eat asparagus, your urine's going to smell, okay? But usually it doesn't have that strong of an odor, but they do worry about odor. And then the other thing they worry about is the wetness, right? It's just, I'm going to wet all over. How's that going to be satisfying in that? So, you bring up some really good points with that. And I want to stress to people that, urine is not going to harm you. Okay. I mean, urine shouldn't, like when men will say to me, well, if we're having, sexual in penetration sex, what if urine gets in my wife's vagina? Well, that's not going to harm her. Okay. It's not going to harm anything. So it's not going to cause a infection or anything like that. So I tell people don't, but if you're really worried about it, wear a condom and that, but also talk to it with your partner about it.
Mm-hmm. Yes, it's so interesting. You bring up the same things I recommend too. And I tell people all the time, don't worry about it. The one lady was like, when you ejaculate, something comes out of you and goes into me and it's not a problem. So now if you leak urine during it, it's okay too. And I say they're often more concerned about it than the partner. The partners are usually like, it's okay. It's all fine. We're not having problems. There's no issue. Urine doesn't cause difficulties if it goes in the vagina, the mouth. You think when people are having oral sex, there's probably urine somewhere there, because it's like you urinate out of the urethral meatus in men and women, and it's not going to hurt anything. So, but as you said, I often recommend throw a condom on it if you're worried about it. You can do that. Empty your bladder before sex, throw a condom on it. And then, like you said, you can use a tension ring around the base of the penis. Sometimes that will help too. But don't worry about it. Sex is supposed to be fun. It's supposed to be enjoyable.
And one of the things that it has been helpful for women really is changing position. A lot of times when the missionary position, the pressure on the abdomen in that area may push some urine out. And I say to them, well, try it differently. I don't know, to have sex from behind, penetrative sex, be on top, that type of thing. Try something different. And actually that can be very exciting, right? Hey, let's do something different this time because I'm concerned about this. And it is important to remember for both men and women, keep that bladder as empty as possible. I think that, maybe require a little bit more planning, Jeff, but, that may be okay. But again, talk to your partner about it before that. I think that if you don't talk and it's something that happens and they're surprised, I think that's a real downer.
I think that's so important. But like you said, I guess I just want to remind our listeners, remember, the goal of sex is connection, feeling a deep connection with your partner, and fun. It's supposed to be really fun. And the mystery and excitement of what will it be this time, I think that can be really enjoyable. So don't get caught up in worrying about things like the urinary leakage and the things like that. Just enjoy. And like you said, we talk all the time on this show. Try a new position. Try something fun or different. Definitely, like you said, sometimes you can, if depending as we get older, we have to change positions anyway. Positions don't always work like they used to. So sometimes that position from behind may work better for you. There's so many different things that you could explore and enjoy. And also, when your partner is pleasuring you, don't be thinking about and worrying about odors and incontinence and things like that. I had one couple who told me, look, one of our preliminaries is what we love to do is we take a shower first. Then everybody's clean, everybody's good to go, and we can have a wonderful time and not worry about anything. And that's another thing that you can do if you'd like. You can have some fun in the shower and then move into the bedroom, or you can have all your sexual activity in the shower. Mix it up, have fun, enjoy, but don't worry.
Yeah, you brought up another good point. Depending on the degree of incontinence or leakage, during intimacy, you're right. Do it in the shower. I mean, if you're really concerned about that and you feel like, oh, it's just too much, do it that way. It doesn't really matter. The other thing too that we say, I say to men all the time, having urine in your partner's vagina isn't going to harm them, and they'll say, but what about oral sex? It really depends on the couple. Urine in the mouth is not going to harm or whatever. Again, urine is not some kind of, bad type of thing in the sense. Most, you're not going to have bacteria in that. Usually there's no bacteria in urine. So I tell people that, really it should not be a problem. I've never heard someone to be a problem, but I do know that a lot of times with partners, if someone does have some leakage, they do try to avoid oral sex. And that's sad, I think.
What's really funny is when you think about, we've all seen those movies and those shows where people under very difficult circumstances to survive will drink the urine because it gives you fluid. So it's not going to hurt you. It's definitely not going to hurt you. Remember too, in the shower, maybe you got a shower chair or a bench in there. That's a great position because certainly you're not going to cause as much pressure on the bladder in that position either. So that could be fun. If you got a bench or chair in there, make sure it's sturdy because we don't want anybody falling or hurting themselves in the shower. Right. But just have fun and be creative with it, right?
I think the most important thing that's coming out of this podcast, I hope, is that discuss it, right? Discuss it with your provider, bring it up, but also, or discuss it with a friend or whatever, but also make sure you discuss it with your partner. Whoever you're intimate with, bring it up because really, work through it, right? You want to work through it, but you don't want to be surprised by it. I think that's kind of the worst thing that can happen, especially if it's someone you haven't been with that long, or maybe if it's someone new. You really do want to talk about it beforehand.
I worked on a project and a qualitative study called To Tell or Not to Tell about disclosure of urinary incontinence with the Simon Foundation. And again, even when we were exploring that, there's a lot of shame, a lot of things around it. But know that you're not alone, because here's the thing. If you've lived on this planet long enough, first off, when you were a baby, you certainly had urinary leakage episodes. But as men, as we live longer and our prostate impinges on our bladder neck and squeezes there, we have urgency, frequency, leakage, and all of us experience these types of things. You're not alone. After prostate surgery, so many of the patients initially will struggle. Often they get better. But again, and then women, we've worked with women over the years, Diana and I both, who have had this stress urinary incontinence, urgency, frequency, mixed incontinence. It is so common, so you are not alone. I have a good question for you, Diane, that goes right along with what you've been saying and given some good suggestions. This person said, I've started avoiding sex because I'm afraid of leaking, just like your patient during intimacy. How do I talk with and work with my partner to work towards being sexual again?
Well, I think that, really that you need to bring it up and you need to say that, hey, I have a concern that I may leak during and talk about it. I think that you want to get an idea of What are their views on it too? I mean, are they concerned about it? I mean, people have a lot of taboos, and you and I know incontinence, there's a taboo. Just incontinence, let's take it away from just leakage during sex. Incontinence in general is something that people are embarrassed by and hide, especially women. They'll live with it for years. They'll go buy a pad to manage it. But I have so many of my female patients who have never told their significant other that they have the problem. Okay. Men talk about it, but women just hide it. And we don't quite understand why, and they self-manage it. But I really think you've got to be open, and really, if that person doesn't accept that, then there's a problem with that relationship. Okay. And I think that you got to work through it, but don't live in fear, because I can't imagine having some kind of intimacy with someone and always worried, oh my goodness, am I going to leak? Am I going to leak? I mean, there's no pleasure there, right? So the thing is, you got to be upfront with it beforehand.
Yeah. And the thing is the secrecy, just like with sexual trauma too, the secrecy causes more fear, more stigmatization, makes you feel more isolated. Of course, you have to choose who has earned the right to be a part of your story, but your partner hopefully is that person that has earned the right to be a part of your story. But I think talking to others, the right ones that you choose, not everybody, but the right person about what's happened to you and what you've struggled with. But too, like you, my patients, they feel such shame around it. Fecal incontinence as well. It's just, can you imagine? I mean, how difficult. And I know those of you out there, even if you don't have this consistent problem, we've all had something happen to us with something like this. Everybody, I don't know if you live long enough, first off, you had it as a baby, but as adults, as we get older, these things happen. And so you are not alone. But I know they just feel so isolated. But I think sharing can be freeing for some people with the right person. But it can be challenging, and it can be scary. But
you're right. No, I agree with you. And we're living longer, and we're living longer well, aren't we? So we're going to be seeing more problems, especially with the bladder issues. And like you said, I think we didn't even talk about bowel leakage or fecal incontinence, or they now call it anal incontinence. And, people have flatulence incontinence. I mean, that, I've had patients say, oh, I pass gas during sex. Again, we talked about that. That could be pressure again. But, I don't really want to have sex anymore. I get so embarrassed by it and all that. And sometimes as a clinician, when I bring up the subject, it sometimes is a huge discussion, right, Jeff? That tends to be sometimes the point of the whole visit. And you've got to work through that. And I think sometimes just admitting to it and talking to someone about it is somewhat freeing, because a lot of times patients will come up with their own ideas about, well, maybe if I do this, it might help, or this is when it happens. And then I'll say, okay, then what can we do to maybe change that or do something so that it doesn't happen again? So I think that, communication is freeing. So talking about it is very important.
And, I encourage all my patients to bring their partners, if they're comfortable, to their appointments and include them in our plan and what we're doing and working on, so they know from the get-go. And so often, I don't know about you, with sexual dysfunction and incontinence, I find the partner is so much more supportive than the patient in their mind believes. Right. The stories we tell ourselves are so negative and challenging, and we believe our partner won't be supportive. And oftentimes the partner's like, I don't feel that way at all. Yeah. I feel very comfortable with this.
Yeah. So what? They'll say, so what? Because a lot of times it's just a small amount of leakage. And the person that's doing the leaking is think, oh my goodness, it's so much. What's going to happen? And a lot of times nobody's even aware of it during the whole activity or whatever they're doing. So You're right. And it's the fear of the unknown, isn't it? Because you don't know the reaction of that person. That's why I say, talk about it, bring it out to the open. You can't live with that secret and that fear, because that's going to affect your sexual activity also. Okay, come on. So The thing is that you really have to be open about it and really talk about it with whomever that you're intimate with.
And remember, I know it requires us to be vulnerable, right? But vulnerability is the only path, as Brene Brown says, it's the only path to love. It's the only path to creativity and intimacy. You can't have intimacy without vulnerability. So I know it's scary, but I'm hoping and praying that you can trust that wonderful someone in your life and that they will surprise you, hopefully, in a beautiful way with how understanding and loving they are about it. So this next question fits right with it from a partner. As a partner, how can I be supportive without making my loved one feel embarrassed or ashamed about their bladder issues?
Well, one thing is, I hate to say, I showed you the statistics. Many people have the problem. Okay, so it's not like they're the only person that has this problem. And they may have, and there's a good portion of individuals who have incontinence and leakage or bladder urgency or having to go to the bathroom in the middle of sexual activity. This is not something that just a few people have. So, number one, learn about it. There's a lot of education, what you're doing, Jeff. There's a lot of education online, even on YouTube, that's very credible. Learn more about it. Seek out some solutions. We gave you some here, but, really have an open discussion about it. Make sure your partner knows, I'm not worried about it. Let's see how this goes. Let's see how we can minimize it. What can we do about it? But just really work it through within the entire intimacy is, I think, the way to do it. But yeah, it can be embarrassing, but really you can make a big difference by really getting rid of that stigmatization, getting rid of that embarrassment by just talking about it.
Right? Because again, like sex is part of the human journey. So is defecating and urinating and all these different things. It's all part of what we have. So I think it's really important to talk about. And I'm so glad that we were able to bring it to light today. And I know, gosh, you have done such amazing work. She wrote the chapter in the second edition of the core curriculum. She was the editor on the first edition as well and she did a lot of great work on stress incontinence with that chapter. I think it's so important to empower people with this information and knowledge. So I really thank you for joining me and helping people understand better.
Well, listen, thanks for having me. And this is a fantastic topic, Jeff. I mean, I don't know if anybody else putting this out there. So I really want to commend you and the whole group here for doing this. So I'm sure you're going to get a lot of feedback on it.
Definitely. And I'm excited about that. So I know it's been a lot for everybody. So as we always do, let's go to our closing centering exercise. We unpack a lot of challenging things here, I know. But I hope you know you are not alone. You are not your incontinence or any other dysfunction or disease. You are so much more and so magnificent. So, you know how we do. If you've ever been on before, you know. As we close today's episode, I invite you to take a moment just for you, just for yourself. If you're able, sit comfortably or lie down in a comfortable position. Gently close your eyes or soften your gaze. Take a deep breath in through your nose and slowly exhale through your mouth. Let's do that again. Inhale, feeling your body rise, and exhale, feeling grounded and safe. Continue that slow breathing pattern, 3 to 4 counts in, 4 to 5 counts out through the mouth, in the nose, out the mouth. Breathe from your diaphragm, fill up your lungs. Continue that breathing pattern. Now, bring your attention to your pelvic area, not to judge it, but to simply acknowledge it. This part of your body does so much for you every day. It deserves your kindness, your patience, and your care. Repeat silently, I honor my body. I deserve comfort, love, and intimacy without shame. I am so much more than any problem that I have. I am enough I am worthy of love and belonging. You are. You are so much more and so beautiful and so magnificent. When you're ready, gently open your eyes. You're not alone. All of us have struggled with some sort of embarrassing leakage episode or something in our lives. So many people struggle with urinary incontinence, fecal incontinence, different types of incontinence. Help is available and healing is possible. Thank you for being here. And thank you to Diane Newman for sharing her expertise and compassion. Vic, can you show us what's coming up next week?
In this episode, Dr. Jeffrey Albaugh talks with Dr. Tobias Kohler, a urologist and men's health expert from the Mayo Clinic. They explain how erectile dysfunction is more than just a bedroom issue. Erectile dysfunction can be an early warning sign of serious health problems like heart disease, diabetes, or low testosterone. With warmth and humor, they show how treating erectile dysfunction can improve overall health and connection. Learn why men should stop suffering in silence and take charge of their health July 22nd at 7 p.m. Central Time on Dr. Jeff Talks About Sex and Intimacy.
It's going to be a great episode. And they just did the Princeton 4 report, and Dr. Kohler was actually one of the authors on that. So I'm really excited for him to talk about the direct link with erectile dysfunction and cardiovascular and overall health. It's going to be an exciting episode. But Diane, I just so appreciate all the incredible work you do, your body of research, all the different videos you put out there, the different peer-reviewed books and articles and things that you've done. And plus, you're just an amazing human being. And it's been a pleasure to call you my friend. And thank you so much for sharing with us today.
Well, listen, Jeff, thank you so much for having me. Thank you for bringing this to the audience, okay, to the world, because seriously, these are things that we got to talk about. And people need to know where to go for help, but also the fact that they're not alone.
Definitely. And I think the episode showed you that. I hope so. My hope and prayer for you is that you move forward in the best and most awesome way. Thank you for joining us.